Hello everyone, I am Dr. Gulati. So today we are doing a hernia surgery. Hernia surgery traditionally was done by open procedure. Nowadays, on a routine basis, we are doing it either laparoscopically or robotically. The only advantage of doing this surgery by minimally invasive way is that the recovery of the person is very quick. Next day he is ready to go back to work. The pain is minimal and the exposure is very good. Sometimes you get hernia on the other side also when you are doing an inguinal hernia surgery. So with the help of laparoscopically, you could identify the other side, and if required, you can repair both sides of hernia at one operation. Laparoscopy is making small holes in the abdomen, and so with the help of ports, you are operating. So you cut open and see it. You have to make a big incision to see inside. But when doing laparoscopically with small holes, you can have a better vision, which is magnified. So the vision is much improved when you're doing laparoscopically as compared to open. So most of the surgeries nowadays are done with the help of laparoscopic or robotic sometimes. Advantages of laparoscopic surgery is that first, the vision is better, it is magnified, the blood loss is much less compared to open surgery, and for the patient, the recovery is very fast. The pain is minimal. So patient is back to work within next few days after a laparoscopic surgery. The operations which can be done laparoscopically depends upon your own expertise and experience. Nowadays, most of the operation, whatever we used to do open method, can be done laparoscopically. Whether it's a gallbladder surgery, it's a hernia surgery, a colon cancer surgery. Initially, the colon cancer surgery was done by open method. Now, again the gold standard for a colon cancer surgery is minimally invasive, not open surgery. Then you can do liver surgeries, pancreatic surgeries. Whatever surgeries we used to do by open method now can be done with the help of minimally invasive surgery.